Bor kapati CTV. Kabul, ka machine ka balas snacker pang ka ba kamskem, kamstet, kamklan, bat baduna bam umpnya.
Dr. Chetan ubadi Dr. Joka Apollo Hospital Guwahati ulaong ba kajilla Meghalaya kala le bahaya u ban minta kala de kapor bo un Siew Kylliang ye kinong shong jongkani kajilla ha ka ba un ai ya ka jing sumar ei ka ba shisian shibnai klem shimpisa nakipat ba badun a jing sumar ki han Nazareth Hospital Shillong uni ude doktor na ka bentaban sumar ye ki ba pak singkai but lum bat ki wei ki ba dei na ka benta ki shiang Ulaong ba hakani ka prathai kumba prapo na ka shispa ki brio ki dor ya ka jingpang singkai bat ka daw ka de na mar ka jingki jingki doksa Ulaong ba ki babun ki yo ya kani ka jingpang na ka daw ki kam ki ba kitrei ki don ki ba haban ki don ki ba haban shushong ben bat ki don ru ki ba shuyang ben kum ki nong hikai lani ki pulit penyat kali Wat haba thia aru uong ba ki brio ki la ban pang singkai bat u a jingmun ba haba ki thia ki tensok kim dei ban long ki ba jem than lani ki ba e than bat ula a jingmun ba ka ba biang tam e ka di ka tu sok cotton ban laj na ka jingpang men Unio doktor ula kentui ki pat ba ki baduk ni ki BPL pakin wan Nazareth ban sumar hau bat wat la don kam ban puidru un puid yaki klam kanu ka jing shimpisa naki
So I've been coming on first Thursday and third Thursday to Nazareth Hospital, and generally second Thursday I go to Apollo Clinic, and from now onwards I have decided to sit on fourth Thursday in Nazareth Hospital, where I'll be seeing patients absolutely for free for the so anybody who cannot afford also can always come and show me on fourth Thursday of the month.
Yes.
I'll be seeing patients for free, and for BPL patients, I'll be even operating them for free on fourth Thursday of every month in Nazareth Hospital. I'll be operating them. I'll not be charging them anything for the surgery on fourth Thursday, and also at the same time, I'll be seeing patients for free on fourth Thursday. Above the age of 55, whenever we do the MRI, there is always some amount of slip disc in all the patients, but they also have gray hair. So which means after a certain age, almost anybody is going to have slip disc. So there is a sudden increase of back pain cases because people sit till for long duration in one position, that too abnormally. So how you sit, how you stand, how you walk, anything can cause injury to the muscle and you can have back pain. And ideally, you should not use laptop, you should use computer. And the eye and the top of the monitor should be the same level. Foot should be flat on the ground, knee should be at 90 degrees. And also while sleeping, if possible, use a very thin pillow at night. Between the head and the shoulder, there is a gap. To fill that up, take a towel, roll it, put it behind the neck while sleeping. So it is supported. So most important thing is your ear and the shoulder should be the same level, whether you use mobile, whether you write, whether you use computer, whatever. Your neck should not come forward. That is the ideal thing to do. Because when you stand straight, your back is straight, but the gravity is pulling you down. So the poor back muscles is in a lot of stress. But as soon as you bend the knee a little forward, your pressure from the back is shifted towards the knee joint because your center of gravity comes forward. You are relieved. Another problem with female teachers especially is they wear a bit of heel also. So heel again puts a lot of pressure on the back. Further lot of pressure on the back. So as soon as you bend the knee a little, you find a bench or something, where there is a little elevation. Just a little bit of elevation will also do. Just find anything where you can just bend a little. For example, if you're working in the kitchen also, open the lower cupboard and put the foot like this.
Okay.
As soon as you bend, the pressure over the back will be relieved and your pain will come down. After the age of 40, you have this in mind, okay, maybe I should get my ECG done just to see if everything is fine or not. Why? Because you are aware that your heart has been beating constantly for 40 years. So maybe I should just check if everything is fine or not. Because you are aging. The hill which you are climbing so comfortably, suddenly you feel, no, the hill which you are you are jumping and going down, suddenly you're climbing down the stairs 3 steps at a time at the age of 20, 25, suddenly you start walking slowly. So these are like part and parcel of aging. The slip disc which we are worried about is when the patient has slip disc with the pain going all the way down, radiating down up to the toes, more at night. Patient will have tingling sensation, numbness, more at night. So that pain is actually because of back pain. I've been sitting like almost like say half an hour, 45 minutes. So my sciatic nerve is right there. It can get compressed. Or if I'm sitting like this, where I'm like sitting cross-legged, for example, I'm sitting like this. So when I'm sitting like this, there's a nerve which is here. It can get compressed and I'll have this tingling sensation. So that pain normally has nothing to do with your, that tingling sensation is quite common. Almost everybody will have. Almost 95% of the times, the treatment for back pain is simple exercises. You strengthen your back, your pain will disappear. You trust me, 90%, 95% of the back pain will disappear on its own within 6 weeks. You need not visit the doctor also. Because if there is a muscle pull or if there is a ligament injury, which is the most common cause of back pain, as I told you, normally will disappear within 6 weeks. Any pain which persists for more than 6 weeks, that's when you're supposed to definitely visit the doctor to find out the cause. Any pain which is felt more at night, where you have tingling sensation, numbness, then you have to visit the doctor immediately. You need not wait for 6 weeks. Otherwise, most of the back pain, or you have back pain with loss of weight, loss of appetite, fever, visit the doctor immediately, because there can be multiple causes. So far surgery is concerned, surgery is only for a very selected group of patient where there is a weakness of the leg, where there is tingling sensation, numbness. Otherwise, there is no role of surgery. Back strengthening exercise and not belt is the treatment for back pain. Avoid belt for correction of posture. That is not going to help. Rather, you have to do neck strengthening exercises and back strengthening exercises to correct your posture. Honestly, I request my patients, you use a cotton mattress. Nothing can beat a cotton mattress. All this orthopedic mattress and this and that is all, I believe, it's more of advertisement. The cotton mattress will actually take your shape of your body, and it is one of the best mattress which you can use. Hard mattress, not recommended. Very soft mattress, not recommended. Firm, just enough that the posture is maintained.
Pin real squat, ya kak tin la jong pin dan kam, ya kabakan kiyo kak tin khasi, kak tin la jong, I kan roy kan pa.
Kanu ka kot ban sakhi, ban pin scam, ban pin itu, kadai ka sirna. Kanu ka jing ai nam ai buram, kadai ka khusna. Kinu ki kot ki sla ki badon kam, ki dai ki dulir. Ken mau certificate dai ka sirnot, award dai ka khusnam, but documents dai ki dulir hakak tin khasi. To dai kan mau ken det ho. Lapan mi da ka pati CTV, na ka benta ka jing mentoy upat ba.